Welcome to CivilNet. My guest is Dr. Jane Mahakian. Dr. Mahakian is a gerontologist specialized in helping adults with cognitive impairment caused by Alzheimer's disease and other dementias. She's also the founder of Alzheimer's Care Armenia. Thank you for joining us, Dr. Mahakian.
Thank you so much, Ani. It's a pleasure to be here.
Again, so we met once in 2019, yes, in the same studio, as I said, and we talked about what it was like in Armenia to help people with Alzheimer, and we also raised the issue of awareness and visibility of the disease, services and programs to specifically treat people with the disease. 2 years later, has there been any progress to that end?
Well, absolutely. There certainly has been. As you know, Alzheimer's Care Armenia's goal really is to lead the way, to develop innovative programs and services, really to enhance the quality of care and services in Armenia for people with memory loss. So certainly, the programs and services are an important part of prevention of risk factors, for example, diagnosis and treatment, and the support of people with dementia and their families. So this pioneering work that we've done since 2017 really leads the way, and I'm happy to see some of the growth and development of other programs developing in Armenia to support elders. Most recently this year, a very innovative program, Robin the Robot. I'm sure you have seen the news at the Newark Old Age Home. Back in 2019, when you and I met with a young man from Expert Technologies, Garan Kachatourian, and we met, and I thought, this is an interesting idea to use Robin the Robot as a possible therapeutic application with older people, with older adults. So we're very fortunate to have the funding of the H. Hovnanian Family Foundation to support this project. The project is a research project, and we're currently in the phase of post-testing. So this application of really using a robot to improve the well-being of institutionalized elders is innovative, it's creative, and we're really seeing some amazing changes in the elders at Newark Old Age Home. One of the developments is that the robot has truly become part of their family. And so the robot, Robin, will stay for another 8 months or so at Newark Old Age Home, because the elders there are they're just really feeling so close to Robin. So this project is going to be, it is very valuable and meaningful, not only for Armenia, but for elders throughout the world. This innovative type therapy really helps people with dementia, it helps people with anxiety, as well as depression. So I'm very excited about that.
Right. So that was the second question, actually, to see how technology can actually help mental diseases such as Alzheimer. And you talked about the depression of the patients, but Alzheimer is also related to the loss of your memory. How does that help the patient with their memory exactly? How depression is related to the loss of memory?
Well, how it really works, this artificial intelligence really recognizes the elders' emotions and interprets their facial expressions. And it also builds responsive dialogue. So many times when that person, as you can imagine, has a cognitive impairment, the first thing that is noticeable is their short-term memory. So Robin has been special programming to mirror back some of their challenges and to play actually cognitive games with the elder. So the robot is now doing exercises to improve that person's functioning short-term memory, as well as immediate memory too. So it really is kind of another toolbox, shall we say, to really help people with dementia as well as depression and anxiety. It lifts the mood and it makes people feel really good when they're interacting with Robin.
So when you have patients with these kinds of disease, they're sometimes, if I understand correctly, lacking of interaction with people, and that might also bring to degrade their situation. And having a robot, for them, it's not a robot anymore, that's a companion, a daily companion. These kind of interaction, communication with someone is helping in some way with their disease.
Absolutely. You know, too, is the timing of this project is very meaningful. This project, it has occurred during COVID times. And during the COVID times, as you know, enhanced isolation and loneliness was rampant throughout the world in memory care communities, assisted living communities. So Robin has really played an integral part in joining our elders at Newark Old Age Home and in really changing their mood, changing their outlook, and giving them some hope. We have some stories, life stories of people, what their stories about what their life was like before Robin arrived. And it's really, truly remarkable, the changes that we're seeing.
So the changes are more related to their mood? You mean like you feel that they are less depressed?
They are less, we're finding, of course, we're now in the post-testing phases, you know, but what we've observed is they're less depressed. When they get up in the morning, they want to greet Robin, they want to be with Robin and do things, you know, speak with Robin. They want to join with Robin. And we're finding that also that their cognitive skills, their ability to speak more fluid has improved. People who were not speaking in full sentences are actually now singing with Robin. So that, you know, taps another area of our brain, the ability to sing, and Robin's relationship with the elder has enhanced that skill. It is truly amazing to see. I was fortunate enough to be in Armenia last month and observe firsthand this relationship between this very special robot and the older person.
So let's talk about another program that you established when you came to Armenia in 2019. It was it was a memory club in the Oran Center in the Lori region. And you've been working with that center and you've been working with the patients. A memory club means that losing your memory isn't irreversible. So 2 years later, what results of your involvement did you see with the patients?
Well, what we're seeing in the memory club at Oran, as well as the memory club at Newark Old Age Home, there's soon to be a memory club at Mission Armenia shortly. But what we're seeing is a sense of belonging, a sense of enhancing creativity skills. This memory club was research-based. It's a very innovative research-based club that looks at all facets of that person's functioning. So cognitively, we are seeing that there are some improvements in not only their relationship to socialize and have a sense of belonging, but also, again, not in short-term memory, but also long-term memory. So in the memory clubs, like at Newark Old Age Home and at Oran, they are doing reminiscence of looking back at older memories and how that ties in with that person's life, and really making them feel that they're empowered, which is very important. Again, these kind of programs are very important because they make that person feel like they have a purpose. And when we have a purpose, we want to get up in the morning. We want to do things. They feel better about themselves, that they're a contributing member of society. And even though a person may have a memory loss, they are a contributing member, and we just have to figure out and help them do that.
And then you wrote a book entitled I Hear You Talking and Listening to People with Alzheimer. Your book is a guide to help those who have to take care for someone who has the disease. What advice would you give to those who don't know how to help, for example, their parents?
You know, that's a really good question. A lot of the approaches to a loved one with memory loss has to come really from a real understanding of the disease. The disease is, these are behaviors that are occurring that are not on purpose. I think educating oneself about the disease, Alzheimer's disease and other dementias is pivotal to really understanding the best way to communicate. For example, when a person keeps repeating information, there's a reason why they're repeating that information, right? So many times I will provide that, you know, consultation to really have that person understand, why is my parent repeating information? Or why does my parent say that items are missing in the home and that perhaps somebody stole those items? So every behavior has meaning. And in the book, I Hear You, we talk a lot, my co-author and I talk a lot about that. Because if you understand the behaviors, you'll be able to really diffuse a lot of the really resistance and anxiety that goes along with the disease.
Well, thank you very much, Dr. Mahakian, for this talk.
Absolutely. As always, Ani, it's a pleasure, a real pleasure.
Thank you for joining. Thank you for watching, and continue to follow CivilNet.